All right, it's time for our Kegel exercises, Twila.
Yes, it is.
And so why do we do our Kegels? Well, it's important for our pelvic health for both men and women. It helps, these exercises help support our pelvic organs in women, the bladder, the vagina, the rectum, the urethra. And for some people, it can actually improve sexual functioning. Some people say it makes orgasms more intense and more frequent.
Well, I think that's a good enough reason to do them right
Nobody's going to
there.
argue with that, I don't think. So let's go ahead and do it.
Okay. 3
Times a day.
6
Days a week.
9
Seconds per Kegel.
and 12.
Kegels in a row to make a rep. It's so easy. Just do 12 of these 3 times a day. When you're doing them, hold it for 9 seconds. You will be the envy of your neighborhood. You will have a pelvic floor like a chain link fence, so you will be able to pull a trailer.
If you so choose. And don't forget, you can always go to the GynoCast Facebook page and get an infographic, which kind of details out the customizable plan. You can print it out, put it on your fridge. You can put it up in your office. We can share it with your friends. And it's a great resource to have. So
Indeed.
Make sure that you go and do your exercises today.
Yes.
Stay tuned.
Hello, everyone, and welcome back to the GynoCast. My name is Dr. Eric Heegaard, board-certified obstetrician and gynecologist, and I am here with my buddy, my wingman. You said you gave me permission to say wingman.
Yeah.
My co-host.
Wait, you called me a wing woman last time.
Well, but you said to call you wingman.
I said either one. It's fine.
Wing woman.
Yeah, it's fine.
My buddy, my boss, Twila Dang.
Hi, how you doing?
Nice to see you again.
You too.
It is always so nice to just spend time in your orbit. I feel like a little human satellite that's just sort of spinning around your orbit.
Listen, I'm going to take all the compliments I can get today, so thank you very kindly.
Well, that's the great thing about listening to podcasts from Matriarch.
Yes, indeed.
Digital media, because basically you get to float around in Twila's gravitational orbit.
Well, hopefully not just mine. It's not all about me, I promise.
So today we are talking about endometriosis because March is Endometriosis Awareness Month. And so those of you who have listened to me on live radio and Twila on live radio in the past and have listened to the GynoCast have heard me talk about endometriosis extensively. Why? Because it is an area, a condition that means a lot to me. I'm passionate about it. And for those of you who don't know what it is, let me tell you. You want to know what it is, Twila?
I do.
Okay. Endometriosis, everybody prepare yourself. Get your pen out. Endometriosis is a condition where there are cells found in the body that are similar to, but not identical to, the lining of the uterus that bleeds every month.
Okay.
Which is called the endometrium. And so that's why we call it endometriosis, because you find cells somewhere else in the body besides the lining of the uterus that are similar to, but not identical to the lining of the uterus. And what does that do? It causes pain and inflammation. And this is a condition that has been understudied, poorly treated forever, in terms of women's health. And so why do we care? You know, there's a lot of things to worry about. There's a lot of chronic conditions. But the reason you should care, in my mind, is that it affects up to 10% of women.
Do you think that's an underestimation?
Well, I'm not sure.
Given the poor diagnosis?
Well, pretty much every study I've seen says somewhere between 5 and 10%, but it may be. We don't know, because it is something that part of the problem is, and one of the reasons I want to do this show today is to talk about awareness of the condition, because it's important to know how to treat the condition, but before you can treat it, you got to know it's there.
Yeah.
You have to be able to diagnose it and to find it, and it's on average, it can take at least 10 years before symptoms arise and a correct diagnosis. 10 years. And that is a time, oftentimes during which a girl, an adolescent, a young woman is being incorrectly diagnosed, incorrectly treated, and oftentimes having surgery and diagnostic studies that are looking for other things that are expensive and uncomfortable. And oftentimes, if they're having surgery, it's not the correct surgery. And so they go for years and years and years with a diagnosis that's not correct or poorly treated.
Okay, so you're not saying that it's 10 years of, like it takes 10 years to become like fully symptomatic. You're saying it takes 10 years to figure out, in most cases, that this pain or something that they've always had is actually endometriosis.
Correct.
Okay.
Correct. And the symptoms are, in general, and these are the hallmark symptoms. but the most common one is painful periods. And oftentimes these are not periods that you just take a little bit of Advil or Tylenol. These are periods that are so bad that a girl or an adolescent or a woman has to miss work or school or normal activities. And so, it's not just mild cramping. These are oftentimes periods that really impair a woman's quality of life. That's number one. But then you go beyond that. Painful periods, painful bowel movements, painful urination, painful intercourse, which is one of the major symptoms as time goes on, and pain. Just pain. Oftentimes it starts in early adolescence, and it may start out with the hallmark symptom of painful periods, but as time goes on, they're not just getting pain during their periods. In the worst scenarios, they have pain all the time. And it can go from being something that's an annoyance to being something that is disabling. Disabling in its worst cases. It is... these women are almost crippled by the discomfort they have. And in the United States, it's estimated that right now there's somewhere between 7.5 and 10 million women with this condition. Wow. In the United States alone. And apply that, globally. And, you're talking hundreds of millions of women, maybe,
Right. Well, you've already established that because it's sort of so poorly studied and so poorly diagnosed that we probably are getting some sort of an underestimation of how many women actually suffer from this, because we haven't really developed the best set of sort of long-term tools to recognize it quickly and early.
That's right. And so the two main issues I want to bring up is that there's pain. Endometriosis causes pain, and it also, in its worst, as it gets more severe, it can cause issues with fertility. Mm-hmm. And so on top of this, on top of the pain and the issues possibly with fertility, you have isolation and a situation where oftentimes, and I've seen this so many times, and I've seen family members break down crying when they find out the diagnosis, is that these girls oftentimes, these young women, feel isolated, and their symptoms can be minimized. It's dreadful. So you have a 12-year-old girl or 13-year-old girl, for example, who's bouncing around and swinging from trees and doing, doing what kids do, all of a sudden start having her period, and she has such severe pains that it keeps her from doing what she wants to do. Now, on top of that, sometimes many of the women in her family, or the people around her, may not have had a similar experience. Sometimes it runs in families, and a mother will say, I had the same thing, we got to do this. But oftentimes it doesn't. And so you have women around her who don't understand what's going on and don't know how to identify with the fact that they've had periods, and perhaps they were uncomfortable, but it didn't keep them from going to work or going swimming or whatever.
Right.
And so they look at this young girl, they don't understand what she's going through. They can't sort of empathize with it. And so they start, and this is just normal, they start to think, well, maybe she's exaggerating. And then and she's usually typically a teenage girl, which automatically leads you to thinking, oh, you're being very dramatic. Right, exactly. Mm-hmm, mm-hmm. And then they may go to a practitioner of some sort, a doctor or whatever. And again, I think this is the embarrassment of my specialty. The embarrassment of gynecology is how poorly we recognize this symptomatology, this condition. It's just dreadful, and that's in gynecologists. This is what we're supposed to do. Not to mention internists or family practitioners or midwives or whatever. Yeah, and if we don't identify it, we can't expect these people to do it. And so their parents who justifiably say, "Okay, we're concerned. Let's bring them to our doctor or whatever." And then the doctor says, "Oh, everything's fine."
Right. Well, I mean, I think you hit on a really important point, because a lot of times when a woman has endo, and especially if it develops when she first, starts having a period, so like 12, 13, 14, 15, that's their first line of action is not the gynecologist for that kid. We take them to the family practice doctor.
Exactly.
And then the family practice doctor is working from a specific skill set and a specific understanding. So, I mean, I guess that leads me to sort of like a bit of a sidebar question. Would you recommend that all young women that start their period have should the first point of contact with a gynecologist be when they start their period?
No. Okay. No, it shouldn't. For a couple of reasons. One is that for most girls, it's not necessary. Mm-hmm. Number two, it's horrifying for them oftentimes to jump into that kind of specialization.
Yeah.
They may have, ideally, they would have a relationship with a pediatrician or something like that, someone that they're comfortable with talking to about all the normal changes that happen in adolescence.
Right, with someone that they have an established history with.
But
so then that makes it more important even to in terms of the lack of training.
Exactly,
right?
Precisely, Twila. This is if you get nothing else from this podcast, and listen for another 2 minutes, and then you can go do whatever else you want.
No, you can finish listening.
No, you got to listen to the whole thing, because we're going to talk about naked yoga at the end of this, and we are, and goat yoga. Twila couldn't help herself, but in any case, realize this: that painful periods that impact a girl's life need to be evaluated, and don't just take someone's, even a practitioner, a nurse practitioner, a midwife, a family doctor, or even a gynecologist or pediatrician's word that this is. If they say it's normal, say, this is not normal. It's not normal, and oftentimes this is one of these conditions where families and girls need to self-advocate. So get information, and I'll just say this now in case some of the listeners here are thinking, yeah, I want to hear about naked yoga, but I'm not going to listen to all the rest of it. And so go to there are great resources out there. The Endometriosis Foundation of America, the Center for Endometriosis Care, Nancy's Nook on Facebook. So if you are on Facebook and are perhaps one of the 0.0000% of people who are not on Facebook, join Facebook and seek out Nancy's Nook. It is run by Nancy Peterson, who was the nurse for many years for one of the founders of really modern endometriosis surgery, Dr. Redwine. And she has this nonprofit organization that when I first got in contact with Nancy, there were maybe 5,000 or 6,000 people on it, which is a lot.
Yeah, for a Facebook group, absolutely.
But now it's, I think, up to 25,000 women with endometriosis. There's tons of fabulous information, and it helps with part of the issue of feeling isolated. Mm-hmm. Because this is, I think, one of the main tragedies of this condition. Going back to what we were talking about just a little bit ago, is that these girls, adolescents, young women, have these symptoms. Perhaps somebody in their family knows what it is or has had similar ones, but sometimes they don't. And then they start being treated like they're exaggerators or that they're crazy. And everybody starts to feel crazy. The girls feel crazy. The parents feel crazy.
Right, because there's a frustration level that
it's
builds.
just terrible. And this is where I go back to some of the experiences I've had, and it happens all the time, where I finally come out and talk to a family, and they break down in tears because the families feel tremendous guilt that they have not
that they didn't feel like they were listening to them.
It's terrible. And so think about it. If you're girls, if you're adolescents, if you're nieces, whatever, young women who are in your sphere are having these symptoms, then please advocate for your loved one, advocate for yourself, and get out and get information. And these are some of the organizations that are that can help you do some, just build up your own information base so you can help know what to do. And we'll put this in the syllabus too.
Yeah, you should actually, like the idea that you hit on, the idea of them being advocates. I think that's a really important piece, and we talk about it. That's sort of a recurring theme here at the GynoCast, is the idea of you are your own best advocate. So you are the person who knows your body best. You're the person who knows the people that you love best. And no, you're not expected to go out and sort of become a medical doctor or a medical expert. But what you can do is get enough information so that you understand how you need to communicate to a health professional to be heard. Sometimes that's very specific. That's understanding this might be this, and you come with symptoms and you say, well, this is what we've observed. This is what we know at home. This is what we've seen at home. This is what I know about my kid. My kid behaves this way all the time, and then right now they don't behave like this.
That's right.
And being able to really, push that point home. And I say it over and over again, I'm a lay person. I happen to be married to a medical professional, and I work with you all of the time. Yeah. But I am just like anybody else in a doctor's office. I become immediately in my head inferior because I think, well, you know more than I do, and you went to school for this, and I'm the one that's here that's not well or needs a checkup or isn't sure what's going on. And And when somebody walks in with a lab coat and their name's embroidered in the pocket and they have the medical chart and they know the jargon, you just immediately think, you're smarter than me, I should defer to you.
Yeah.
You don't have to do that, and
Yeah.
you can't necessarily do that. You are still, I always tell people to turn the paradigm. Think of yourself as the customer, and they're providing the service. And when you think of yourself as in a position where somebody needs to give you customer service, you think differently about all of it. And that's important. It's important to know how to say, I'm not satisfied with the information I'm being given. It's okay to say that to the doctor. It's okay to say, I need more information from you. I need more of an explanation from you. If you don't feel like you're getting that, if you feel like you're being stymied or not heard or ignored, guess what? You can go find another practitioner. You are absolutely allowed and encouraged to delicately or not so delicately fire your doctor and go get another one. Yeah. You have to do, and I understand, even I've heard over time people say, well, you say that and then that's insurance. I go, I understand that. I understand that's a difficulty. I'm not saying you can immediately go tomorrow and get another doctor. I understand how the insurance system works. But if you know that you're not satisfied with the care you're being given, go find someone who will provide the type of care that you need. Do your research. Ask questions. Go ask other people. Go ask your friends and people in your network. Join something like Nancy's Nook and get recommendations for people in your area that might be able to be of service to you. It's worth the legwork, and it's worth sort of the headache of dealing with somebody and having an uncomfortable exchange to prevent yourself from, 1 year, 2 years, 5 years, 10 years, hell, 1 day of pain and discomfort that you can avoid by getting the answers that you need and being put in the care of someone who can really help you.
That's right. And so the ideal circumstance is that a girl or young woman has these symptoms. The people around her recognize that it's not normal. They do their due diligence. They go to the right resources, and they find a practitioner who is skilled and knowledgeable in endometriosis, and so they can be adequately evaluated and treated. Because the whole goal of this, and again, coming back to kind of the goal of this podcast today, is that if we can intervene early, you can change the trajectory of people's lives, of young women's lives, where if we can intervene early, proper care, we can have these women ideally go on, grow up, and have full lives where they can do all the things they want to do, or they might go on a different path of multiple incorrect surgeries, multiple treatments, paralyzing, incapacitating pain, infertility. It is dreadful when you get to the end, people who've had this for years. And oftentimes by the time I see people, they are on that road. They've had multiple surgeries. They've had pain for years. It's just heartbreaking. And I literally feel like crying when I see some of these people. And I love working with women with endometriosis because even though oftentimes they feel like they've got poor pain tolerance, these are the toughest women out there. Mm-hmm. And they've been told their whole life that they're complainers. And what do? Most of the time, instead of being disabled by their pain and sort of succumbing to it, they go on with their lives. They get educations, they raise their families, etc., and they have pain. They have pain and they live. They're tough as nails.
Absolutely.
Tough as nails. And when somebody finally gives them an accurate diagnosis, it's this vindication. It's this lifting of this heavy burden, and they realize that that they're not crazy, and the people around them don't find out that they're not crazy. And so please listen to these symptoms, listen to the women around you, the girls that you care about, and be alert to this diagnosis. And if you're suspicious of it, talk to them, do your due diligence, go to some of these resources, and get to somebody who knows what they're doing. In the last year or so, and I don't operate on a ton of young adolescents, but I've had younger girls, as young as I think, I don't know, the youngest one I've operated on, probably 15.
Okay.
And every once in a while, 16, 17, that sort of thing. But, I'll just tell you a vignette about one of the patients I just remember, which is a girl who was, I think, 17 at the time I operated on her, who had been going through an evaluation for pain for 5 years. She'd had colonoscopies, which is obviously looking up the colon.
Yeah.
She's had endoscopies where they look down their throat and their stomach. She had, a gastric emptying test. She's been to a pain clinic, physical therapy, homeopathy, acupuncture, this, and this.
Wow.
And finally they I don't remember how they found out about me, but she came in and we operated, and I found endometriosis all over, on every surface of her pelvis, including on her distal rectum and pelvic sidewalls, and and to be able to come out and show her the pictures, the parents and this young girl, the pictures, and she just wept. She was in pain, and she wept because someone finally gave her some diagnosis that makes sense.
Yeah.
It makes sense.
Yeah.
And is that the only thing going on? No, and sometimes there can be multiple other issues that can cause pain. But this was probably the main reason why she was having the symptoms, and it only took her 5 years.
Well, and imagine 5 years of being a young person and how difficult it already is to be a young person. But imagine being a young person and thinking, we're gonna do this, and you trust your doctors, you trust your parents who trust the doctors, and they go, okay, we're gonna give you this test, and this test doesn't lead to an answer.
Yeah.
We're gonna give you this test, and this test doesn't lead to an answer, and you do it again and again, and even while you're doing these tests and looking for answers, you're still month to month going through this pain, going through the elevation of pain, going through the escalation of pain, and wondering like, why am I the only one going through this? Because most of her friends and things aren't going through this, and nobody else kind of understands that she's having this experience.
Yeah.
And so I can only imagine how relieving it had to feel, just to feel like, 1 + 1 = 2. Like there's an actual answer to something that she never had an answer to before.
That's right, and it's a wondrous thing to see and to be a part of. And again, this young woman who'd had this extensive workup and all these other diagnoses, luckily nobody had actually operated on her yet. She had no, which is a remarkable thing, and because you want somebody who does a lot of endometriosis surgery.
Mm-hmm.
Because you got to know what to look for and you got to know what to do, and that goes into sort of the treatment of issue of aspects of this condition. But again, I am in some ways less, wanting to emphasize less the treatment and that sort of thing, because it's more
recognition.
The recognition,
recognition,
so you can intervene early and change girls' lives.
Well, I have a question
it's so
for
important.
You.
Yeah.
So when you talked about sort of the symptoms, when you talked particularly about pain, is the overall, I've noticed, at least with sort of my community of family and friends, that sometimes period pain is not measured in pain. It's measured in like other symptoms like nausea.
Yep.
Like, is that a pretty, like I noticed that for me personally, I have a pretty like severely high pain tolerance, much higher than I realized until I didn't realize how high it was until I had kids. And because you just think when you're young, you shake things off sometimes.
Yeah.
But what I noticed is there were things that when other friends of mine would complain about like their period symptoms, they would be like, I felt, nauseous all day. I knew my period was starting. Yeah. And I would just not, I guess for me personally, because my experience was different, I wasn't equating it.
Yeah.
And then like years later, some of those women came back and they're like, oh no, I got an endo diagnosis. I didn't realize I had it. And so even the way we perceive and measure pain as sort of lay people is different than how a doctor, sort of scales pain. So I'm always wondering, are there other symptoms that you see typically that sort of present as one thing, but most likely are something you should be paying attention to?
Yeah, that's a great question, because by the time I see somebody, almost invariably they have gastrointestinal symptoms. So, there's a lot of women who have endometriosis will discuss there's a symptom they call endobelly, where they can look like they're pregnant. Their bellies are bloated out.
Oh yeah.
And you can have constipation, you can have diarrhea, you feel bloated, sometimes nausea. And the thing is that you don't want to attribute everything to endometriosis, but what I would like practitioners and listeners, lay people, to think of is just it could be endometriosis.
Okay.
It's and don't, because a lot of times I've seen someone just like this young girl who's been scoped from above and below and had all this stuff. Well, you could have oftentimes it's possible to have a gastrointestinal condition too, but oftentimes by the time I've seen people, they've almost all got irritable bowel syndrome.
Right.
Everybody's got that diagnosis. Why? Because, they have constipation, they have diarrhea, they have bloating, and you can't figure out. If you're not looking for it, you're not going to find it. And, they may have been scoped from above and below, and you don't find any obvious pathology or abnormality there. What else is it? Well, irritable bowel syndrome, which is a real condition. I'm not trying to minimize that, but things can look alike. And if you're not looking for other reasons for it, you might give the incorrect diagnosis. Or it may be endometriosis and irritable bowel syndrome.
Mm-hmm.
Could be endometriosis and inflammatory bowel disease. It could be endometriosis and food sensitivity. And there's you got to look for more than one thing. And so we all have to open our minds to other possibilities and just put it on your radar, because the cost of missing it can be profound.
Right. And I think I think there's nothing wrong with understanding that in the sort of scope of symptoms when you're looking at it. I think you just want us to sort of figure out how to get to the point where it's one of the things we check for. Like it should be on the checklist, and it shouldn't be sort of the outlier diagnosis that we eventually get to. It should be in the sort of top 10 of regular things that when we say, hey, you have these symptoms, it could be this, 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 or this. And it should always be on the list of, hey, we should check for this.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
So one of the other frustrating things when you're talking about practitioners and people who don't understand this condition is that sometimes you're running up against the wall of I hate to say this, but kind of ignorance, and even in people in the medical community. So, for example, I've had an administrator come up and question me about operating on a 16-year-old girl. Mm-hmm. Why would you do that? And endometriosis is something that happens in older women, not younger women. So I've had to actually go and educate doctors, administrators that, this is real. You have to, and it's so frustrating. Not only do we have to find the condition and treat the condition, but you have to run up against the ignorance of people who should know better.
Yeah.
And
how do you even begin to, bridge the gap on that when, in terms of like the actual professional community?
Educating people around me,
mm-hmm.
and including this administrator where I sent him information. And, talked about these patients. And I said, well, let's, why don't you look at the pathology when I get it back? And boom, endometriosis all over the place in this young woman,
mm-hmm.
And I actually sent him an email back saying, well, please let me know if there's something you would have suggested that I do differently. And I, of course, never heard back.
Oh, yeah.
And but I said,
that's because you were probably being a wee bit smug.
I was. Well, I don't think I was being smug. I was just because it was so annoying. It was so offensive to me.
Yeah, you were just like, look, you know me. I'm good for walking in with proof and being like, I got proof now.
Well, I will tell you this: because they're young and they're women, they have no political power yet. They have very little value. If you don't have political power,
I have a. That's actually a really valid and solid point. The idea that one of the many ways that we dismiss women and girls, particularly girls, that we are very we minimize girls. We minimize their feelings. We minimize their experiences, and it would make perfect sense given how we treat them on the whole that we minimize their pain.
Yeah, it's just because in our culture, if you have a bone sticking out and there's blood spurting. If you have a hatchet stuck in your head, if there's trauma, we are great with that.
Right.
If you can see something that is, destructive in terms of our anatomy, great. We can't see what's going on inside people's bodies sometimes, and they suffer. Oh my God! It's not just endometriosis, but lots of conditions where people just suffer
mm-hmm.
agonizing pain, and they can look just fine.
They look healthy.
And we, just the lay population as well as doctors especially, need to be open to thinking about things differently and realizing that these conditions exist that cause huge suffering, and to dig a little deeper. And you can't do that in 5 minutes,
Yeah.
And some of these office visits that people go cruising in, and the doctor might have 15 minutes in and out. Boom,
well,
boom,
if it's a regular, like if it's not you sought them out because you're in pain appointment, you sought them out because it's a regular checkup, and then they ask you the couple of questions about how's this going? How's this? We know they don't ask deep questions, and we don't usually answer with depth because we don't want to be a nuisance, and we've already been waiting an hour, so we kind of got to get back to work, that kind of thing.
So and it's just, I guess now I'm getting fired up, Twila.
Yeah, well, listen,
Can you see my veins bulging?
I know you have been. You've always been very passionate about this, and I have learned a tremendous amount. This was something that is a condition, and is something that impacted women that I knew little to nothing about when we met, and to hear you talk so passionately about it, and me going out and educating myself based on the information you give to our listeners constantly, I am much more of an advocate now. I talked a little bit offline. I had a family member that I've been saying for at least the last year, I think this might be endo. Like, based on what you're telling me and based on what I know from Dr. E, you should go get X, Y, and Z done. And it took a while to get this person to just, kind of go, okay, I'm going to go ask those questions. Yeah. And they did. And they got a diagnosis. And now they're it's transformative.
On the road to recovery, if you catch them early enough.
Yeah. This was pain that she went through for a very long time. And now she's not in that kind of pain. And now she can actually look forward to, like getting beyond that pain and doing physical therapy and getting back to things that she enjoyed in life that she just had kind of given up on because she thought, I'm just going to always be in pain like this.
Exactly.
And it doesn't have to be that way.
Right. And so, one of the things that, we want to shed light on things that really impact, that are not discussed. I know we've joked in the past about, we talk about things on the GynoCast, that people don't talk about in polite company or spinach dip and that sort of thing, which is true. But we need to start talking about this because it's out there and it can be disabling. And so again, we'll have in our syllabus, we'll have some resources. And I want to tell you, I've had some patients of mine that I've encouraged to get out, and like the Endometriosis Foundation of America has some programs for getting in and educating nurses and young people about the symptoms of endometriosis. Because my feeling has always been, we got to get into middle schools, to talk to the people, to educate people in middle schools, and people are getting out there and doing that. A few of my patients I encouraged to do this, and they have started doing this in Minnesota.
Wow.
I think a couple of them got together and made a presentation at the Minnesota Nursing Association, that sort of thing. Get out. We got to get people to know about this so they can recognize it, so they can intervene, so they can change the trajectory of people's lives. Yes, Twila.
Yes,
give me a high five.
High five.
Oh, I feel like I'm just about to tear my shirt and start running around the room.
Okay, don't do that. That's a lot.
Yeah, that's right. Just like you don't want to see me tear my shirt and start running around, just like you do not want to watch the video of the naked yoga that I put on the GynoCast Facebook.
Okay, we're not doing it. Okay, I'm indulging you. I may literally give you 30 seconds about this naked yoga.
Okay, well, we're not there yet. Yeah. So, in any case, I think we were talking about the symptomatology and pain, gastrointestinal symptoms, bladder symptoms. But another thing to keep in mind is anything that's cyclical. So if, because you can get endometriosis anywhere. Usually it's in the pelvis, almost 99% of the time. But there have been cases where they found it in the brain, they found it in muscle, they found it in the lungs, which creates the mystery of this condition.
Yeah.
And that's a conversation. What causes it is really a conversation that gets so scientific in some ways that it's beyond the pale of what we're trying to do here. But so, people, for example, somebody who might have endometriosis in the lung, they might be coughing or cough up blood, for example, when they have their period. Or they might get extreme headaches during the time they're having their period, because these little lesions, these little spots of endometriosis that are similar to but not identical to the lining of the uterus, oftentimes will bleed in response to the hormonal changes. So when a woman has her period and the lining's bleeding, they may be bleeding from these lesions inside their pelvis, in their lungs, in their brain. And so if somebody says, if somebody's, complaining of horrible headaches when they have their period, well, it's most likely menstrual migraines. But you have to keep it in mind. If somebody's coughing and notices respiratory symptoms when they're having their periods and it's cyclical, keep it in mind.
Yeah.
You got to think about it.
Well, that's even, I guess from the advocating for yourself point of view, I always say when I go to a doctor's office, I always know everything I can tell them about my body. I never put myself in a position where they ask me a question and the answer is, I don't know, because I'm tracking. Like if I'm going for a yearly checkup and it's my gynecological exam, I know when I have my periods. I know if something weird has been going on, I track it in my phone or I write it down somewhere so I can say, you know what, at this month it was kind of like this. Or over 3 months, it was kind of like this. I make sure that I have answers to questions. I know how to describe my pain. So if they say, I don't just say I was in pain. If they say, oh, you were in pain. Yes, it was a sharp pain. It was right here. It was like this. Or it was a dull pain. Or it was a rolling pain. Like I'm able to describe with a lot of specificity. Being able to do that is one of the key ways to be an advocate for yourself. Because you can help the doctor pinpoint what's going on with you faster by actually being able to have the vocabulary to give as much detail about what you're going through as possible. And that's a really, really powerful tool to have.
That's right. And so let's talk a little bit about, we talked about the symptomatology, which is just pain, oftentimes cyclical, at least in the beginning. But the pain is usually confined to the pelvis, but not necessarily. Mm-hmm. So how do you diagnose it? Well, number one, you got to recognize the symptomatology, because if you're not looking for it, you're not going to find it.
Right. And
so a lot of it is just taking a patient's history, listening to her story, and physical exam can be very helpful. And so, a lot of times in modern medicine, we don't, an exam is sort of oftentimes superfluous. And you get CTs and ultrasounds and MRIs and that sort of thing and lab tests. Physical exam actually can be, in this condition, can be actually pretty helpful, because on a pelvic exam, and sometimes, God forbid, I know everybody hates this, a rectovaginal exam, you can find tenderness, nodules sometimes. You can feel that the uterus or cervix is pulled one way or the other, because the suspensory ligaments of the uterus can sometimes be involved with endometriosis, and they get shortened and thickened, and so it gets pulled one or the other. The direction that the uterus is tilted, you're feeling for pelvic masses, etc. So physical exam can be helpful sometimes. Ultrasounds can be helpful if there is a cyst of endometriosis called an endometrioma on the ovaries. So sometimes you can get endometriosis that implants on the ovary, kind of sinks in and starts creating bleeding into the ovary, and it creates a cyst over time. You can see that with imaging studies like MRIs and CTs and ultrasounds, but usually an ultrasound, if there's no mass or cyst, will not find endometriosis, because endometriosis is a surface condition.
Right.
It sits on top of the lining of the pelvis in general, and you're not going to see that. So a negative ultrasound doesn't necessarily mean doesn't mean at all that the endometriosis is not there.
Okay.
Or is there. So physical exam, taking a person's history, is probably the most important thing in terms of identifying whether someone might have endometriosis or not. Imaging studies like ultrasounds, etc., can sometimes be helpful. But really the ultimate diagnosis, unfortunately at this point, is to look inside surgically and see.
Okay.
And again, you don't want to operate on somebody unnecessarily, but sometimes if you don't know what else is going on, the idea is ideally to go in and make the diagnosis. And if you have somebody who does a lot of endometriosis surgery, not only do you make the diagnosis, but you ideally treat the condition. And most of us who do a lot of endometriosis surgery and deal with a lot of endometriosis in general believe that cutting it out is the way to do it. So a lot of doctors will go in and they'll see it and they'll take a little cautery and buzz. But in that situation, you're really just getting the superficial aspect of the endometriosis lesion. It's like endometriosis can be like an iceberg. What you see on top does not reflect what's going on the bottom.
Right.
And if you just buzz the top, you're just getting the part of the endometriosis lesion that's popping above the water. Cutting it out, and there's different techniques for doing that. You get deeper. You ideally get the lesion out entirely. And we believe that in doing that, you decrease the chance for recurrence and give better symptomatic relief.
What kind of surgery are you normally talking about here? Is it like more invasive surgery? Is it more laparoscopic surgery?
Well, it's usually almost all the time. I'd say 99% of the time we can do this laparoscopically, minimally invasive.
And I'm saying that like I know all the doctor terms because I watched all my episodes of Grey's Anatomy, but you should probably explain what laparoscopic is.
Well, in the old days, virtually all surgeries were done by taking a scalpel and making a big incision and cutting in and looking with your eyes, but as technology's moved on, medical technology, we moved into minimally invasive laparoscopic surgery, which we've been doing for decades now, where you put a camera into the abdominal wall with a small incision and you look around. It's amazing what you can see, and usually we make other little small incisions where we put other instruments through, so we're looking through one hole and putting tools through other little holes, and we can...
How small are the holes?
Well, they vary anywhere from 5 millimeters to 10 or 15 millimeters.
Okay, and that's really small. I mean,
those are small.
Yeah, when you think about it.
And so, there are many superb minimally invasive surgeons that just do, I shouldn't say just, but they do their endometriosis surgeries using just traditional kind of what we call straight stick laparoscopy, and these are some of the best in the world. Some of us, I almost invariably use the robot, so robotic assisted laparoscopy. Why? Because it works for me. Is it better? It is better for how I do it.
Mm-hmm.
But again, if you talk to Dr. Second, who's the founder of the Endometriosis Foundation of America, and Dr. Sonervo, et cetera, from the Center of Endometriosis Care, there are the best of the best endometriosis surgeons and others. I'm just naming a couple, but they do everything for the most part with their traditional straight stick laparoscopy. They're fabulous at it. There's a number of us who do a lot of endometriosis surgery who use the robot, and and we think that for our particular way we do things, it works. I like it. It works well for me, and but I'm not saying it's better or not better. It just kind of depends on the surgeon. But the idea is you make these small little incisions. You put the tools in there, and you cut out or laser out. But the idea is that you go deep and you cut that stuff out in its entirety. Whatever technique you want to use. I use scissors and hooks, and some people use lasers. It's very variable. But the people who know what they're doing get in and cut it out one way or the other. They don't just kind of superficially buzz it.
Right.
And that's what you want to do. And it is an experiential sort of specialty, meaning the longer you do it, the more you do it, the better you are. And the more you see it, the more you find it. Because I know that I see endometriosis now much better than I did 5 years ago or 10 years ago or 15 years ago, because I know what I'm looking for. Endometriosis has many different types. And so sometimes, and most doctors or gynecologists know about, they describe it maybe as powder burn black sort of lesions. They literally look like powder, gunpowder, black little splotches in the pelvis.
Oh, wow.
Those are easy to see.
Yeah.
A chimp could see that if he knew what he was looking for.
Right.
And so there's also just red flame, they can look like literally little flames of fire. But there are other types that look like just little blisters, clear, blister-like or vesicular lesions that are oftentimes, very difficult to see if you don't know where to look and what you're looking for. And then there's another variant on the other side, which is what I would describe as white fibrotic or scarred. And so a lot of times you could look in there and just see what looks like scarring, maybe from a previous surgery. But sometimes in those situations, the endometriosis is buried deep inside and under. And so again, if you don't know what you're looking for, you won't find it. And so the goal is to see these abnormalities and cut it out. And so a good example, I recently saw and operated on a woman who's had pain for years, has had a hysterectomy. Well, her surgeon, took out her uterus, leaving the cervix in place, which I never recommend in people with pain or endometriosis, because then what happens is that the endometriosis starts to implant on the cervix. So then he went back and took the cervix out. And then eventually he went back and took one ovary out, then the other ovary out. And she kept having pain, and little by little just had bits and pieces taken out. And finally I saw her, and she's now not had surgery for years, but she's got this horrible pain. And we finally decided to go ahead and look. And she had this white fibrotic scarred stuff all over the place. And I cut it out, cut it down to the normal tissue. And the pathology came back positive for endometriosis. And this woman was in agony, and post-surgical, very, in agony to begin with, and also just having post-surgical pain. But I came back and just talked to her about the diagnosis, and she started crying. It's just like, really, she was basically, I was telling her, you're not crazy.
Right.
You're not crazy. Look at this, and you can show everybody around.
There is something wrong.
And so you got to look for it. You want to find somebody who does a lot of this surgery, and going to the resources I've mentioned, you can find surgeons and doctors who have experience, so you're getting somebody who knows what they're doing. So that's diagnosis, physical exams, some studies, listening to a person's history, surgery occasionally, and then how do we treat it? Well, we're going on to treatment and diagnosis, but ideally you want to find somebody who knows what they're doing, so they're not just looking and saying, you got it.
Well, how do you find I guess that's a good starter question. How do you find somebody that knows what they're doing?
Well, that's why, there's some of these resources I mentioned, like Nancy's Nook, and the Endometriosis Association, Endo Warriors. These are places out there that can have, resources. Sometimes they list physicians who they've gotten good recommendations about, who do excision surgery and that sort of thing. So,
and remember to do your due diligence when you're looking for those kind of resources and you find somebody in your area. Do your cross check. You can check with that doctor, see if they're taking new patients. Also check with your insurance company, make sure, see where the ins and outs are, of what your insurance will cover, what it won't cover, what you're willing to sort of go out of range. Some insurance just don't do it. Some have like tier 1, tier 2, tier 3, and you can make decisions based on what you can afford versus, what you need.
And then you want to, meet with these doctors and see if you connect, ask good questions. And there's a lot of these resources have questions to ask the doctors.
I feel like you're overdue to write a book. Sidebar.
Okay.
Sorry.
There's a lot of books out there, but
I know. I think you're overdue to have a comprehensive resource for people that are going through this process as newbies.
Well, thank you. And there's a lot. There's.
I know. I shouldn't have said
that
out loud because when he does it, I'm gonna publish it and just messing around with my own money.
Yeah. So you want to find somebody who knows what they're doing and do a little due diligence and find that person. And then how do we treat it? Well, surgery's not generally the first thing we do. A lot of times we may try medical management. There's medical management of endometriosis and surgical management. Oftentimes we do both. Mm-hmm. But, if you have a 13-year-old girl who comes in with horrible periods, no gynecologist should say, okay, let's operate. The first thing that we oftentimes do, we'll try some sort of medical management. What does medical management do? Well, women make 2 main hormones. They make a ton of hormones. But I'm just saying.
Yes, we're wondrous.
Yeah. Well, I love. I will tell you this. I'm going to take full credit for this little expression. Okay.
Okay.
But I've thought about this for years, and it applies to everything. Is that we are just souls, Twila, just souls floating in neurotransmitters and hormones. I can take you. You are a solid, straight, smart individual who's not going to go and blow anything up, right?
Yep.
I could screw up with your hormones and your neurotransmitters, and you would be out there, going crazy. And so,
isn't that what happens when you fall in love?
Yes,
essentially.
Yeah, essentially. So, but the main. So now I'm getting off track here.
Sorry. Yeah. Wait, I'm supposed to be the producer.
Pull me back.
Okay.
Pull me back.
No, what are we talking about?
So, the main female hormones that. Reproductive hormones, or at least estrogen and progesterone,
mm-hmm.
and they have this yin-yang sort of effect on the lining of the uterus. Estrogen makes the lining thick. It's like water on grass, Twila. Water on grass. Isn't that lovely?
Indeed.
Progesterone has the opposite effect. It thins it out. It's like a little lawnmower buzzing that lining down. And so you got the stimulative effect of estrogen, the suppressive or thinning effect of progesterone. So when we try to manage endometriosis medically, we're doing one of 2 things. Because the endometriosis lesions respond to hormones similar to the lining of the uterus, if we decrease estrogen levels, it's basically taking the fuel away from the fire. And if you don't water the lawn, it's going to die down.
Yeah,
right?
Exactly.
So either decrease the estrogen, take the fuel away, or increase the progesterone, which the thinning effect of it. That's virtually all the medical management we do. For example, if you have a 13-year-old, we'd probably start you on a birth control pill. Birth control pills have a predominant progesterone effect to it. So the suppressive effect of birth control pills is stronger than the stimulative estrogen effect. And so that's why, people on birth control pills tend to have lighter periods, less painful periods. And so sometimes that's all we need to do is just put people on a birth control pill. There are other medications that some can actually put a person into temporary menopause by dropping their estrogen basically down to 0. Nobody really likes that, but
right.
There are certain situations where something like that may be appropriate. Or we can give people high doses of progesterone, and sometimes that can be helpful by suppressing these lesions. We sometimes use intrauterine devices that release low doses of progesterone because it has that continuous sort of bathing of the uterus and the tissue around it with progesterone. There's an old medication called danazol, which was actually a form of testosterone, which we very rarely use. And I'm covering this just so people know about it because it's out there. And for some people, this can be very effective depending on where they are in their life and what their goals are. But oftentimes, if that doesn't work, depending on a person's situation, we may need to go ahead and operate and do what I described before. Ideally, go in, identify, cut it out, restore anatomy, and help them feel better and perhaps restore fertility.
Okay.
Whew. And you got some supplemental oxygen, Twila?
No, but you're
like
very good at this. I told you this is
Oh,
like
Twila.
this is your sweet spot when you talk
From
about this.
From my fragile ego, you are so. Wow, Twila, you are
Don't
making me blush.
Okay, don't break out the Colonel Sanders accent on me right now.
And so we didn't really talk about where endometriosis comes from, and that's almost a whole topic that you could.
That's okay. You can have that be another.
Well, I'm just gonna.
day.
I just want to touch on it a little bit because it gets so deep and it's so complex for that. Basically the answer to that is that there's probably more than one thing going on. This is kind of fascinating though from a historical standpoint. They used to think that endometriosis was caused by what's called retrograde menstruation, and this was created by a guy named Dr. Sampson 100 years ago, about 100 years ago, and he kind of cleverly realized that women, and this happens to virtually all women, that when they have their period, some of the blood comes out their fallopian tubes and lands and falls into the pelvis. And his idea was that that blood that falls into the pelvis has little living cells, and those cells plant like seeds into the lining of the pelvis. And then they plant, and they start to grow and respond to the hormones of pregnancy, or the hormones of the ovary. And like I said before, when a woman has her period, those little implants start to bleed too. Our bodies don't like blood inside our abdomens, and so it causes pain, it causes inflammation. That's been around for 100 years, Sampson's theory. The problem is that 95%, probably even more, of women have retrograde menstruation, but only 10% of women have endometriosis. So why not 99% of women have endometriosis? So there's something different going on. And also from a histological standpoint, if you look at that tissue, it's not identical to the lining of the uterus. It's similar, but not identical, so it doesn't make sense. And so there's a lot, that old theory, it just doesn't fit the gaps, and it doesn't describe how you can get endometriosis in your brain or your lungs. How do you describe that? So, some people think that it can travel almost like a metastasis, like cancer in the bloodstream and the lymph system, and go to other places and plant there. There's information that there's probably an immune aspect to it. For some reason, women who have endometriosis, the immune system doesn't recognize these cells as abnormal and kill them off and allows them to grow. And so there's immune issues, there's genetic issues, there's lots of different things. There's information and research to suggest that it is sometimes found in the body as a fetus. So some women are born with it.
Wow.
And perhaps, again, that may be a variant. We're not exactly sure. But without a doubt, they found endometriosis in fetuses, even male fetuses. How do you explain that? And so the thing is that it's not a problem until they get activated at adolescence, generally. Mm-hmm. So these are the girls that, are swinging in trees and swinging bats and running all over the place, and then they get their period, and boom, they start having horrible pain. The reason is that endometriosis has been sitting there and just got activated by estrogen. And then there's there's also theories and evidence to support that certain cells get converted to endometriosis cells, like stem cells or other cells get converted under the influence of genetics and hormones and whatever. Oh. And that's metaplasia or changing. So the bottom line is that there's a lot of different theories as to how endometriosis is made and the foundation for it. And again, that much of this is just needs to be filled out. And I'm not entirely sure. I believe this, that I don't think it's one condition. I think there's more than one condition that at the end looks the same, mm-hmm. but the foundations are different. So it's exciting if you don't have it. If you have it, it may be interesting, but it's miserable.
Yeah. And
so to be discussed further. So again, thank you for listening, and please go to some of the resources we talked about.
Yeah, everything is on the syllabus.
Be aware. painful periods that impact your quality of life are not normal.
Yeah, and if you want more information, it's super easy to get it. Go to our website. Go to matriarchdm.com. There is a page for the GynoCast. You click on that page, and the syllabus will be there.
That's
you
right.
can print all of this information off. You can share it with people if you'd like. We also have a couple of other online resources. If you go to Facebook, we have a group. The GynoCast is a private group, and
That's right.
you can go
Very
to...
exclusive.
Yeah, so you go to Facebook, type in the GynoCast, and request to be a member. We don't just have it open. It is a closed group for a reason. We have difficult, sometimes challenging, sometimes vulnerable conversations about things, and we want to provide a safe environment for that to happen. We have a wonderfully supportive group of men and women who are participate in this page, but we always want to make sure that we keep the integrity of that group intact.
That's right.
So you request access, and we will give you access. We also have a Facebook page for a matriarch, so if you go to Matriarch DM, it's Matriarch Digital Media. I know, I was so close. If you go to Matriarch Digital Media, you can like the page. We talk about things that we talk about on the show here. You get updates on what's going on with the show itself and other things. And you can also communicate with us now.
Yeah,
we have a
that's
shiny
excellent.
new email address. It's
This-
called hello
It's good.
at matriarchdm.com.
So join our little family. Join
Yeah.
the Matriarch family. Join the GynoCast family. And I just want to say that, on the GynoCast Facebook site, people talk about everything. They talk about intimate things. They ask each other questions. There's
And
like
give
a little...
support. Yeah, it's a wonderful space. It really
It
and
is.
truly is.
And it's respectful. It's all about respectful discussion. And I will post things that I think are interesting. For example,
For example,
the naked yoga. So I'll just say that if you
I'm
if
glad
you
you
have
brought this
nothing
up
else
at the
to
end,
do,
so when I cut it out, it won't be missed.
are you going to cut this out, Twila? Don't cut this out. It is so, and so I was looking at something that kind of looked at something. Then I got to yoga, and all of a sudden, and so I found out that there are these people doing naked yoga, and and I put a video of this woman trying to describe what the advantages of naked yoga are, and
Right.
it is, I don't even know how to describe it. It's funny, it's horrifying, the whole spectrum. And I'd like to know
I just
what
like that the
could
lady
compel
that was
somebody.
talking about it was like evidently like a really young, like hadn't really had kids yet, still has that body that will look back in 25 years and go, it was the best ever was. I just didn't know it yet. And it's like, I want people to be more comfortable. Well, you know how we can be more comfortable? Not standing around naked in our stretch marks and floppy parts, looking at you with your non-stretch marks and non-floppy
Well, that's the thing.
parts.
So that she's standing there, and that's fine. But there's all these people around who look like regular people,
Right.
And I just want that shows something about the confidence that these people have in their body. I don't know.
Amen. Listen, I
know, that's
think
fine.
we all need to aspire to that level of confidence. I would love to aspire to the level of confidence that allows me to do naked yoga in a public place. I couldn't even get topless on the beach in a country where everybody else was topless. So I don't think it's ever going to happen for me. But
So there's
I
already
encourage you.
there's already been some interesting conversation.
Oh,
about
indeed.
that.
It's okay. Listen, the page has been on fire. People have been very lovely, good sports about it, but we have had some definite back and forth debating going on.
Yeah.
Sort of about the merits of it, but that's
They're
one
not
of the
just
many
dog.
things you
They're
get.
not just dogging the video.
No,
they're
there's
downward
actually,
dogging.
yeah. Be quiet. And there's your sign right there. Don't forget, if you want to support the show, go to your provider, subscribe to the podcast, download it, give us a rating, a review, all that good stuff. And as always, we do this because of your support, and we really appreciate it.
See you soon. Thank you.